The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUwebinars, and YouTube at tinyurl.com/MUwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUWebinars, and YouTube at tinyurl.com/MUWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID 19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is HPV Gone Viral, the Silent Epidemic, or HPV Gone Viral, ang Pagapang na Epidemya. Today's forum aims to discuss the burden of disease, risk factors, prevention, and management of HPV infection. For today's forum, we have Dr. Maria Rowena del Rosario Raymundo, the Vice Chancellor for Academic Affairs, OIC, and Assistant Professor 5 of UP Open University, subspecialist in infectious disease, and consultant of San Pablo College's Medical Center as our moderator. Welcome to the MUla. Welcome
Hello and welcome again to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, Mu Sigma Phi Foundation, UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum is a series of panel discussions that aim to address common concerns of women from all ages and walks of life. And today, we are on the sixth leg of the year-round webinar. Today's topic will start our series of discussions on HPV infection. For any questions for our speakers later, you may type them into the Q&A boxes of UP Manila live stream and Zoom, or the chat boxes of FB Live and YouTube. Our sixth webinar, entitled HPV Gone Viral, the Silent Epidemic, gives us a general overview of HPV infection. This forum aims to discuss the burden of disease and risk factors associated with human papillomavirus infection. It will also give us advice on measures to prevent and manage the disease. To formally start the webinar, I am honored to introduce our esteemed speakers. Our speakers for today are both alumni of the UP College of Medicine and distinguished members in the field of infectious diseases in obstetrics and gynecology, Dr. Ricardo Manalastas and Dr. Maria Angela Rodriguez Bandola. Our first speaker is Dr. Ricardo M. Manalastas, Jr. Dr. Manalastas, whom we fondly call Dr. Butch, is an alumnus of the UP College of Medicine class of 1983. He is currently practicing as an infectious disease specialist of the Department of Obstetrics and Gynecology in PGH, and is also a professor at the UP College of Medicine. Please join me in welcoming Dr. Butch Manalastas of the Mu Sigma Phi fraternity, batch 1983.
Thank you, Wen, and good afternoon to all of you. It's a privilege to give a brief presentation and join the open forum later on the occasion of this webinar in honor of our late mentor, Dr. Jalbuena. If I may just try to share my screen. Right. Um, as I talk about HPV, the silent epidemic, it's going to be a brief lecture. We have support from MSD for this webinar. And this will be the outline of my presentation. I'll be talking about the burden of disease from this virus, the different risk factors of acquiring both infection and the disease, and how to prevent it, the preventive measures. Right, let me first clarify a little bit. These are very specific terms. Epidemic is widespread, and I'd like to emphasize that here the term widespread. Let me try to get my pointer going. Widespread occurrence of an infectious disease in a community at a particular time. So when there is, they differentiate it from an outbreak. An outbreak is it's not as widespread as epidemic. We are in a pandemic right now. The only difference in simple terms is it's an epidemic that has involved several countries, just like what we are having in these times now, COVID. Whereas endemic is something that belongs to a particular people or country, not necessarily widespread. Right? So, for example, malaria is endemic in certain parts of our country. So we think that there is an epidemic of HPV because it is, as I'll mention in a little while, one, if not the most common sexually transmitted pathogen that's around. This is the pathogen. It's a virus. We call it the human papilloma virus or HPV. Very important to know are the several HPV types that are present. We're particularly concerned about the 30 or 40 or so types that affect the genital area. And among these 30 to 40 types, unfortunately, about 15 or so of them, they're what we call oncogenic, meaning they can cause cancer as a disease. No? We need to differentiate between infection with the virus and the disease it causes. When we say disease, we mean the infected individual manifests with symptoms such as cancer is a symptom. And so I mentioned that genital HPV, the 30 or so types, it is believed to be the most common sexually transmitted infection in men and women. So the predominant mode of transmission is really by direct sexual contact. And this is how it is transmitted, predominantly by sexual contact. And I need to clarify that it is not limited to genital penetrative sex. Other ways of sexual contact, like genital to genital, even without penetration, or manual genital, that is touching and fondling, or even orogenital sexual contact can transmit the virus, usually through microabrasions of the involved area. Microabrasions meaning very small breaks in the skin, either of the mucosa or of the epithelium of the orogenital area. Because it is sexually transmitted predominantly, infection with HPV should be rare in people who've never had any form of sexual contact. Right? But as I've emphasized, even non-penetrative sexual contact can lead to transmission. There are non-sexual routes of transmission that are reported, but this is not the predominant way that HPV is transmitted. For example, the mother can transmit to her newborn during the time of delivery. And again, we call this vertical transmission from mother to her newborn. No? This would be rare. This would be rare. Even less often would be transmission by fomites. Fomites are inanimate objects that are hypothesized to transmit also HPV. Again, this would be very rare, but possible. Why do we say it's silent? The topic of the title of our webinar is silent. To explain why silent, I'll have to show you the natural history of HPV infections, just to highlight a portion of the natural history. There is this part of the natural history of the infection where there is latent infection. Latent infection means the infection, unfortunately, remains in the skin, usually the basal membrane of the skin, and it just stays there silent, not causing any symptoms. Can be transmitted, but again, it just stays there. Unfortunately, we don't have medications, either drugs or maybe even the vaccines, that will treat this latent infection in certain cases, right? The problem with latent infection is that having no symptoms, the virus is just there, it can be transmitted without the patient knowing it, and without proper measures, again, it can be transmitted. However, the problem there is it can be reactivated at the time that the infected individual has what we call immune suppression. When the immune system of the individual, for whatever reason, either temporarily or on a long permanent basis, the immune system goes down, it can reactivate and become what we call clinically evident. Now, a perfect example of this situation here is women getting pregnant. We know that pregnancy is a state of immune modulation. The immune system of pregnant women is modulated so that the woman, the mother, does not reject the fetus. That's why we call it immune modulated. And there is the possibility of reactivating this. That's why it's not uncommon for women who become pregnant to have flares, clinical flares of their HPV infection, manifested in many instances as genital warts. When they are not pregnant, they don't have the warts, but when they become pregnant, the warts, genital warts, they tend to proliferate. And then when they recover from their pregnancy again, these genital warts, they have a tendency to regress as well because the immune system kicks in after the effects of pregnancy are over. Right, so that's why we call it silent. Unfortunately, that is a public health problem with HPV. Many infected individuals are in the what we call the latent phase. That's why it's silent, allows transmission. What is the burden of disease as far as these HPV types are concerned in the oropharyngeal area? It's not limited to the genital area, anogenital area, but also the oropharynx. The greatest burden is, of course, on cervical cancer. And as cancers, they die of cancer if they're detected late. But that is not just the cervix, can involve the other genital areas, both males and females. So there's vulvar cancer, vaginal cancer, not as common as cervical cancer. There can be anal cancer as well, both in males and females. Now, certain genital HPV types are non-oncogenic, meaning they don't cause cancer, but they can cause benign diseases or benign lesions in the form of genital warts. Among males, of course, there can be penile cancer, and in both males and females, oropharyngeal cancer. You see, this virus has propensity for certain types of mucosa or epithelium. The epithelium of the oropharyngeal area is very similar to the epithelium of the cervix and the anogenital area as well. So you can imagine that the oropharynx, most usually transmitted during orogenital sex, can be infected with certain types of HPV and lead to oropharyngeal diseases like oropharyngeal cancer, and maybe even what we call the recurrent laryngeal papillomatosis, usually found among young people. So the burden of disease involves many, not just cervical cancer. Don't be intimidated by this slide. I just want to again emphasize that burden of HPV disease is not only in our country, but worldwide. And I'd like to highlight here the most common HPV types that bring about disease, the most virulent, so to speak. The most virulent are probably among the cancer-causing types, the HPV 16 and 18. 16 is the worst, no? Followed by 18, and five other oncogenic types. So 31, 33, 45, 52, and 58. You don't have to remember all of these. I just like to emphasize that there are certain oncogenic HPV types that are responsible for causing the greatest burden of disease. HPV 6 and 11 are the benign types. Benign because they cause non-cancerous lesions, genital warts usually, right? And if we take a look at this, no, these are the 4 HPV types that are most burdensome, causing these percentages of these different diseases right here. And if you included not only the 611, 16, and 18, the next 5 most common cancer-causing types, you get this increase in the percentage of diseases caused by them. Now, later on, when we talk about prevention, the whole idea is if you prevented being infected with these HPV types, these 4 types, you would, theoretically speaking, prevent this amount of diseases. And if you're going to prevent the 9 leading cause of HPV diseases, then you would, again, theoretically be preventing this much disease because they're really the cause of all of these diseases. And then later on, when we talk about the vaccines that are available, vaccines against the 4 HPV types and vaccines against the 9 HPV types. Right. Okay, what are the risk factors for having infection and disease? Like I said, any form of sexual contact, doesn't have to be penetrative, genital contact, any form of direct contact can transmit the, so that's a risk factor. Having multiple lifetime sexual partners is another known risk factors. When they say multiple, some would say 5 or 6 lifetime sexual partners. No? Early sexual debut is a risk factor known to cause to be associated with cervical cancer as well for a variety of reasons. An immune compromised state, again, is a risk factor for not only latent reactivation or reactivation of latent infection, but also of what we call persistent infection, the inability of the immune system to suppress the proliferation of the virus. No? And let me add to that, unvaccinated status is a risk factor, obviously, no? Because the vaccines are known to be effective preventive measures. So we go to prevention. How do you prevent? The current approaches to prevention of HPV infections involve, let me emphasize, total abstinence, no, from all genital contact is probably the most effective. But this is not always possible or realistic, no, in many instances. Lifetime mutual monogamy will help, of course, if both partners are known to be uninfected. Right? Of course, if one partner can be infected, then of course the other partner is also at risk. Condom use, because it is a barrier to skin contact, can help prevent that as well. And there's some literature saying that circumcision can reduce the risk also of transmission for a variety of reasons, which we'll not discuss anymore. So, aside from those behavioral preventive measures, vaccination is obviously one of the more effective ways of preventing HPV infection. We call it a primary preventive measure. Primary because it prevents the infection. And I think after this, Dr. Angel will talk about the other ways of preventing disease. Disease, for example, cancer can be prevented at a stage before becoming cancer. They will detect the precancerous lesions through a variety of means, and therefore that's what we call secondary prevention. So vaccination, let me talk a little bit about the vaccines. We have several vaccines available. There is a bivalent vaccine that contains 16 and 18. So if you recall, 16 and 18, these are the most common virulent HPV types causing anogenital cancer. So there's a vaccine against them. There is a quadrivalent vaccine involving containing 16 and 18 as well. And they added 6 and 11 to that. So both cancer-causing, 16 and 18, and the benign-causing HPV types, mainly genital warts. And then there is this other vaccine. They, aside from the 4 previously mentioned, they added 5 more of the oncogenic types. So far, we have this 9-valent vaccine. So bivalent, quadrivalent, and 9-valent. They're all safe, effective. The main difference is in the coverage of the HPV types. Right? So this is my last slide, I think. Some take-home points lang, and then we'll maybe later on talk a little bit more during the open forum. HPV is a burdensome disease. Unfortunately, it is silent. It can cause genital tract cancers, even oropharyngeal cancers. Genital warts, although they're benign, they can have serious burdens as well, both social, psychological, and behavioral as well. And these are the most burdensome HPV types, and we've discussed them already. They represent the 9 most common causes of genital and even oropharyngeal disease. Primary prevention is through vaccination, although there are secondary preventive measures as well. Primary prevention will lead to the best results in preventing both infection and disease. So the currently available vaccines are safe, they are efficacious against the types that they contain, whether bivalent, quadrivalent, or the 9-valent vaccine. And they've been with us for several years already. I'll stop now. Thank you for the opportunity. Maybe later on we can interact again during the open forum. Back to you, Dr. Wen.
Thank you so much for that very informative talk, Dr. Butch. Ang dami ko pong natutunan. I'm sure that our webinar audience has also learned much from the valuable information that you have shared. Now, to further enlighten us on this topic of HPV, let us now welcome our second speaker, Dr. Maria Angela Rodriguez Bandola. Dr. Bandola is an alumna of the UP College of Medicine class of 1999. Just like Dr. Butch, Dr. Angel is also currently a practicing infectious disease specialist of the Department of Obstetrics and Gynecology in PGH, where she is also a clinical associate professor involved in the training and mentoring of future physicians. May I now call on our very own Dr. Angel Bandola of the Mu Sigma Phi sorority, batch 1999.
Hello. Good morning, good afternoon, everyone. Thanks, Wen, for the introduction. So for this afternoon, I've been asked to give a talk on HPV infection, in particular, how to diagnose this condition and the management options that we can offer our patients. So this is the outline of my lecture. We'll have an overview of HPV infection, and this was covered already by Dr. Manalastas. So we'll proceed to diagnosis and then management. Now, as previously described, there's already a spectrum of HPV-related diseases in men and women, wherein not only are we talking about cervical cancer and genital warts, but for the males, there's also penile and anal cancer, and up above the waistline, we have oropharyngeal cancer and respiratory papillomatosis. No? And we see that it is an epidemic in a sense that we have millions of people who are diagnosed with HPV infection and disease. And this is the breakdown in terms of the males and the female cases. So this is the estimated annual new HPV-related diseases in both males and females globally. Now, for external genital warts, HPV 6 and 11 cause 90% of these conditions, and it's highly contagious. No? It's very highly transmissible with a 50% lifetime risk of acquiring external genital warts. The incubation period before clinical symptoms would be from 3 weeks to 8 months, an average of 2 to 3 months after contact with somebody who is infected with HPV. Now, the clinical presentations would be vulvar itchiness or masses palpated in the vulvar area. For HPV infection and cervical cancer, 99.7% of cervical cancers is caused primarily by HPV, in particular 16 and 18. And before getting to cervical cancer, there is a pre-malignant condition called cervical intraepithelial neoplasia, which is really the target that we want to catch before it ends up to be cancer. So symptoms of cervical cancer can be vaginal bleeding between periods, increased vaginal discharge. If a patient comes to you in the clinic complaining of painful intercourse or spotting after sex, or maybe abdominal or pelvic pain, you have to consider this as a differential diagnosis. No? So this was already discussed by Dr. Manalastas. No? So what happens is that the sexually transmitted HPV enters the cells through microabrasions. And weeks later, the HPV virus replicates. No? And in 90% of cases, this heals naman within 2 years. However, if there is persistent infection, 10 to 30 years later, 3.8% of these cases develop cancer. So this is when the HPV virus already invades the deeper layer of tissues and turns cancerous. So how do you diagnose? First, let's go to external genital warts. Now, it's primarily a clinical diagnosis. So this is what you will see on examination of your patients. You will see the warty-like growths either in the labia minora or labia majora, and they can be very inconspicuous. No? So majority of these patients with HPV don't even have symptoms, and sometimes it's just an incidental finding on routine gynecologic examination. Now, if you're uncertain, you can apply 3 to 5% acetic acid solution to help visualize ambiguous infections. This is how it looks like if the infection is florid. So you can see here that these patients can, of course, you can palpate this already. So our patients will say, I feel like I have a lump somewhere. So these are things that you will encounter in the clinic. And for our general audience, this is how it looks like if it's really severe infection already. So this is a picture. These are pictures of lesions. This is in the perianal area. So these are for the males. The cervical area. So this is a genital wart in the cervix, and urethral warts also on the lower right hand. For cervical cancer, again, if there's already a mass, so you can see here, this cancer tissue already has in the cervix has already transformed the cervix into a bulky mass. So that's a sign that you may be dealing with cancer. However, some patients can be in the early stages where there are no visible lesions yet. So symptoms are pretty much the same, no? So again, vaginal bleeding and postcoital spotting. And we've already discussed the risk factors. So many sexual partners, early sexual contact, other sexually transmitted infections, patients who smoke, and those who have a new partner can be at risk for acquiring HPV. So how do you diagnose cervical cancer? So patients who have these symptoms have to undergo a speculum examination, a pelvic exam, and if there are any visible abnormal lesions, then we proceed with doing a biopsy of the cervical tissue. So you can see here that it takes a while before we end up with cancer. So there is a period of time where we can catch it. No? So it initially is a transient infection. However, if it does progress, you will be able to detect signs early on that there could be a precancerous lesion. And this is where we want to intervene, no? Before we end up with cancer. So screening is very important. And you can screen by either doing a pap smear, an HPV test, or if for diagnosis, do a biopsy. So women would come in to have their HPV test done. And basically, this is how a pap smear is performed. No? So the patient goes to the clinic and a sample is taken from the endocervix. No? There is a change or a shift in the practice guidelines wherein the WHO in their recommendation July 2021 recommends the use of HPV DNA detection, pretty much like our COVID PCR testing, as a primary screening test rather than using VIA or a pap smear in the screening and treatment approaches among the general population of women and women living with HIV. So this is a very strong recommendation, and we do have even if we have these in place, these recommendations, it's very hard to transition to this shift in practice. So it's really a shift in care and may have to, be operationalized after we, eventually. But in the meantime, so here's the recommendations. Now, for the general population, the HPV DNA test is the primary screening test recommended. We should do it at age 30. We should start it at age 30. And the screening interval has increased from to every 5 to 10 years. So you can see the traditional practice would be that you would have your pap test every year, every 2 years, every 3 years. However, now it's increased the interval to 5 years. So I think this is more cost beneficial in the long run. So this is just an example. Like I said, it's very hard to to operationalize these recommendations. So more often than not, we still are reliant on the cytology or the pap test. And it's either going to be the conventional or the liquid base. And this is just an algorithm just to show you what will happen. So if the pap smear is negative, the recommendation now is to rescreen in 3 years with cytology. However, if you get an ASCUS result, the recommendation is to do an immediate triage with an HPV test. If the patient is HPV positive, then you proceed already with colposcopy. And after which, the management would depend on the diagnosis or the histopath results should the patient undergo a biopsy. If the HPV test is negative in an ASCUS patient, then you rescreen after 3 years with cytology. There. But the ideal, I'll just go through it. Okay, so here, the colposcopy. So what is colposcopy? It's a way of looking at the cervix through a special magnifying device called the colposcope. And it shines a light into the vagina and onto the cervix, and it greatly enlarges or magnifies the cervix so that we can find lesions that cannot be seen by the naked eye. So after colposcopy, if you're oncologist or your colposcopist finds something wrong, then maybe a biopsy can be done right there and then. But in the ideal world, this is just the algorithm that they propose where patients are screened and treated, screening with HPV. And if it's negative, you can come back to your physician after 5 to 10 years for another HPV DNA test. If it's positive, your doctor will determine if the patient is eligible for ablative treatment. And if eligible, then they will proceed with that. If not, then they will do a let's and wait for histopath. If there is suspected cancer, then biopsy and further management will follow. So management of genital warts. So what we can tell our patients is that genital warts may spontaneously resolve with or without treatment within 6 months in 10 to 30% of cases. Now, when you give your patients options for treatment, you have to consider the convenience, the cost, availability of machines or medications, the methods of administering therapy, and location of the warts. Now, we must refer to specialists for extensive genital warts or those that do not respond to treatment or are located in specific locations like the rectal warts or cervical warts. So basically, we have a lot of treatment options to provide our patients. Electrocautery or burning. There's also laser treatment. Cryotherapy is another option which has been found to have good results. If it's quite big, then we can proceed with surgical removal in the OR or maybe excision under anesthesia. And over-the-counter preparations or chemicals can be used to cauterize these warts. Now, in general, we use multiple modes of treatment for genital warts. The challenge with treating genital warts is that there is a risk of recurrence. So there's what we call treatment failure, which would signify that you may have to consider a change in the therapeutic options that you're doing. And so there are also medications that the patients can apply themselves. So imiquimod is one such drug that they can use. However, there is also some side effects like burning and scarring also, and a lot of inconvenience for the patient. So for cervical cancer, therapeutic options can range from just excision of that lesion, so conization of the cervix, to radical hysterectomy. And afterwards, depending on the stage of the cancer, the patient would have to undergo chemoradiation. So what I've discussed is that yes, HPV is a silent epidemic. It's highly transmissible with anyone who is sexually active. It doesn't have to be one, or it doesn't have to be many, but then even one person who has HPV can infect already. It's sexually transmitted and highly preventable. through what we discussed and what Dr. Manalastas discussed, primary prevention by vaccination and secondary prevention by detection and screening. So this is our challenge as obstetrician gynecologists. The global strategy, our targets are to vaccinate 90% of eligible girls against HPV and males also. 70% of eligible women should be screened at least twice in their lifetimes and effectively treat 90% of those with a positive screening test or a cervical lesion, including palliative care when needed. Thank you very much.
Thank you, Dr. Bandola. That was very insightful indeed. The past minutes have really been very informative, and I myself learned a lot as well. Dr. Butch and Dr. Angel, both your talks provided us with relevant information on understanding the risk factors and the burden of HPV infection. And knowing the risk factors, along with the preventive measures you mentioned, will surely educate our webinar participants on what they need to do to prevent the occurrence of HPV disease. Now, to also give her insights on today's talks, we have as our special guest, Ms. Michelle Lim, the co-founder and managing director of Prana Movement Studio. Alongside her work, Ms. Michelle also writes entries for her online blog, My Mom Friday. Here, she talks about her journey and personal discovery in parenting two wonderful teenagers. Please join me in welcoming our Mom Friday, Ms. Michelle Lim.
Hello, good afternoon. Good afternoon, everyone. Hi, Dr. Rowena and Dr. Angela.
Hello. Good afternoon. Nice to have you with us.
Okay. Hello.
Hello.
Ayan. Hi, Doc.
Hi.
Ayan.
Okay na tayo.
Yes. Okay. Doc, as a parent, I was just wondering after the lectures from Dr. Manalastas and Dr. Angela, for in terms of age, what is the youngest age recommendation if ever you would consider vaccination?
Well, maybe we could have both our speakers join us and answer Miss Michelle's question. Especially, it's very relevant to her because she's a mom, and it's a very interesting question. So, who would like to answer that?
9 years old is the youngest that you can
Okay.
start, both boys and girls in the Philippines.
Yeah, I didn't expect it to be that young.
There is that issue kasi, yung some parents, they hesitate because obviously a 9-year-old, kunyari, girl won't be sexually active until maybe she's
Yes.
20 or 25, all of that, no? But in the general population lang kasi they want to start them early so you don't miss them. Sometimes kasi 12 or 13-year-old, we know they get pregnant already. Parents, they do not know. So, but then again, something to think about. So the earliest that you can give it according to regulatory recommendations is 9 years old.
Okay.
Mm.
Thank you.
Yeah, Miss Michelle. How old are your kids, if I may ask? You have teenagers, right?
Yes, 18 for my eldest son, and the second is going 15 this January, girl.
Wow, one girl and one boy.
Yes.
If I may ask you, nung lumabas ba first itong HPV vaccine, were you initially already aware of it? Or kasi noong first na lumabas, sa schools una to, sa schools ang nag-inform, no? Pero I'm not sure if the parents all have the same kind of information. So what was your experience
Yeah.
when this first came out? Did you have apprehensions?
Yes. I actually learned it also from my friends who have daughters. So the main concern is really about cervical cancer. It's not, I think the focus at that time was cervical cancer, not the
Mm,
HPV per se. So I think the education in terms of HPV is still lacking.
mm-mm,
We're more focused on the cancer rather than uh, parang I think HPV kasi is one of the causes, but
mm-mm.
we are more focused on the cancer itself and not the HPV.
Right. And HPV is actually the necessary cause of cervical cancer. And but the I think most of the apprehension is kasi sexually transmitted infection siya.
Yes,
Was it ever a
yes,
concern for you na baka it may, if you give it to, kasi syempre the advice is to give it as early as you can before
yes,
exposure to HPV. Nagkaroon ka ba ng apprehension na baka it might, it might give our teenagers ideas na parang, mas free na sila to engage in risky sexual behavior, or it may parang condone premarital sex kasi ganun yung feeling ng ibang parents.
yes,
How did you feel at that time?
yes. Similar to similar to what you said. So parang there was parang the thought, the initial thought is there's really no need
Mhm.
because at that time when I learned about it, they're not yet teens, so it's not relevant for my family, but for the friends who I talked with, they were already concerned that with the generation nowadays, parang they'd rather have their kids protected. So they consider it, but I'm not sure if they push through with the vaccination. Although that's the line of the topic of conversation was the readiness and it's the age. That's why I asked what the recommended age is, because I think it will boil down to how relevant the the virus or parang how it would directly affect you. And of course, the values then, kasi there are different beliefs per families. So it's still something that we will think about twice or thrice before actually having the kids get vaccines.
Yeah, thank you for that, Miss Michelle. I have one last question before we proceed to Q&A. But now, after having listened to the talks this morning, has it changed in any way how you feel about HPV vaccination? Um, what do you think? And if friends ask you, ano kaya ang parang magiging opinion mo after hearing the talks this morning?
Yeah, parang well, I gained a lot of information from the doctors, and of course, it broadened my perspective in terms of the virus itself and the causes, and the possibility of yung cancer, kasi that's what yun yung the scare factor. That's the scare
Yes.
factor. So I guess if it's the age, if it's the right age, and the lifestyle of the the person, well, I would recommend. But for personally for now, hindi muna siguro.
Mm. Okay, thank you, Miss Michelle. Now, I'd like to give a short recap. No, 2 weeks ago, in our previous webinars, we discussed the unlikable prognosis of HPV infection, which is advanced cervical cancer. And today we have tackled the risk factors associated with having HPV infection. And we also learned some preventive measures and management for
Yes.
this infection, right? So now we're about to proceed to our Q&A. These topics have certainly made us more curious about the disease, and our speakers are also excited to hear the thoughts and questions of the other participants, our webinar participants on the topic. So thank you again to our speakers and to our reactor, Ms. Michelle Lim, for your personal take on today's topic. Now, I believe everyone is eager to ask their questions, so let's begin our question and answer session. Again, you may type in your questions in the Q&A boxes of UP Manila live stream and Zoom. or the chat boxes of FB Live and YouTube. And we have a first question. Okay. So the first question is for Dr. Wait. It can be answered by any of our speakers. This is a question from the audience. Good afternoon, doctors. Do we need to give a booster dose for our children who have received 3 doses of HPV vaccine? Thank you. Who would like to answer that question? Doc Butch or Doc Angel? Kailangan pa ba daw po ng booster?
No need for booster.
Need for booster.
No need. As far as what is known for the past more than 15 years already, those who were vaccinated long ago, the very first ones who received the vaccines, there are no breakthrough infections. Unlike COVID vaccine. COVID vaccines, you need a booster. For HPV vaccines, no. So long as they completed the series as recommended.
Doc Butch, paano yung mga nagtatanong, yung mga nakakomplete na po dati ng mga quadrivalent, tas ngayon nakita na may 9-valent na, tas parang feeling nila parang gusto ko yatang mag-add. Are they allowed to have another series?
Yeah, they need to complete the series for the 9-valent. If they want the protection from the additional strains, they can opt to get that also.
Okay, thank you, Doc Butch. Now for Dr. Angel, what are the causes of recurrent HPV infection? Can this be attributed to the various existing strains?
Well, yeah, it could either be a reinfection with another strain, or it could be that a latent infection still exists. So you remove lang a certain portion that has the HPV, but it's still there. No? So it can recur if the patient is immunosuppressed. No? So I think there are 2 ways of having this. It's either in reactivation, a persistent infection, or a reinfection or another infection with another strain.
Okay, thank you, Dr. Angel. Dr. Butch, kanina you mentioned that HPV can be transmitted through non-penetrative sexual contact. And you also mentioned other possible ways of transmission. There is a question here on how can I don't know if this is graphic, but how can non-penetrative sexual contact transmit HPV? Wala namang penetration. Parang I suppose this is like it's a non-penetrative sex. So how or sexual contact, paano siya matatransmit? Paano natatransmit ang HPV? Wala namang penetration.
Kasi whenever there is a break in the skin, even if it's a microabrasion, I think I mentioned microabrasion.
Yes.
So any small break in the skin will allow the virus to enter and cause the infection. So I suppose everyone can imagine, penetrative sex can cause abrasions. Obviously, you can easily imagine that. But even non-penetrative, for example, even before the like oral genital sex, even before the actual activity, there can be already microabrasions. Like if the woman, kunyari, has fungal infection, scratching, and therefore, you can easily imagine there's a break in the skin. And when there is direct contact with either the oral, the lips, for example, and if they're carriers of the virus, that can happen that way. We even have, kaya lang rare, no? Children of women delivering, getting infected. Wala namang sex doon, except that they pass through the birth canal, kunyari, no? So it's possible that these children, usually they have, the lesion is laryngeal papillomatosis. We've had babies also having anal genital warts. Babies with no possible sexual abuse, except that their mothers had genital warts. I think that's an important lesson. Yung iba kasi, sinasabi nila, I'm still a virgin. Virgin, yung definition nila, never had genital penetrative sex. but they're not virgin in other sexual activities. They're in
Right.
oropharyngeal sex, touching,
Yes.
fondling, no, yung ganun. Maybe even sexual toys can of course can transmit.
Yes, that's true. Thank you, Dr. Butch, for
Kaya,
underscoring
if I
that.
may add, kaya yung iba sasabihin nila, I don't need that vaccine. Kasi I am yung iba nga
Monogamy.
sa nila, I'm a lesbian, kunyari, sabihin nila, no, I don't like men. So, walang penetrative sex siguro yun, no? Sabihin mo, but they still get these diseases.
Yeah, scary, no? I think Doc Angel has her hand raised. Doc Angel.
Yes, sir. Actually, there's also a burning question here about how women or men who've never had anal sex, how do they get anal cancer if they have like an HPV infection? Sir?
Oh,
Baka how they get anal cancer from even if they don't perform anal sex.
self-inoculation, it's a regional disease kasi. It's a regional infection. If you get HPV in the penile shaft, for example, it can easily be translocated to the anal area, even without penetrative sex. For example, if you're bathing or you're engaged in self-hygienic procedures, you can easily abrade the skin in the area, lalo na yung perianal mucosa, it's very sensitive. So, yung self-inoculation, generally ang tawag doon, it's a regional kind of infection. Hindi mo pwedeng sabihin, hanggang dyan lang yan. In other areas, it can easily go there. So, walang exclusive, kumbaga, unfortunately.
Yeah. Parang may field effect, no? Parang in that
Yes,
area.
Yeah. Field infection or a regional infection. Yeah.
Yeah, and it's really parang for those who are not for the general population, 'di ba? Lalo na like Miss Michelle who has teenagers. Medyo parang scary din kasi like sabi kung non-penetrative, 'di ba yung mga heavy petting or yung mga rub-rub lang, as long as may microabrasions, it's a cause for concern. Kaya dapat talaga ma-underscore na condoms may not be protective kasi hindi naman lahat ay sa penetrative sex nakukuha. Now, I have a question for Dr. Angel. Bakit daw 30 years old ang age set by the WHO for cervical cancer screening?
Yeah, well, they increased the age before kasi it was at age 21 or some years after the first sexual contact. But what they've found is that before 30 years old, the risk of getting HPV infection is high. However, the rate of spontaneous regression or resolution is also high, meaning it's just really a transient infection. In addition, there may be a higher risk of potential harm from treatment even if there's no, perceived or increased benefit in terms of cancer reduction. So there can be over-treatment for some patients who have, like, for example, a CIN1 lesion, which may resolve spontaneously. So we don't want to subject our women to unnecessary procedures early on in their reproductive career.
Yeah, thank you for that. That's so true. Hirap, ano? But and I have another question here which has to do naman with HPV DNA detection. So is it already available in the country? If yes, how much does it cost? Any of our speakers can answer it.
Yeah, it's available already in our country either as a co-test. So you do a liquid-based pap smear, and then you can detect already HPV. And some tests will give you either a result of high risk for high-risk HPV. So they're able to detect 16 and 18 most of the time. And then there are some tests that actually give you the genotype, so the type of HPV that you're infected with. The cost, 5,000 pesos, I think. For the genotype,
Yes.
it's more expensive.
Mga ganon, ang range, mas expensive ang genotype.
Yes.
Yeah.
14 ata siya if I'm not mistaken.
Pricey, no? I see Miss Michelle's hand raised. Miss Michelle.
Yes. Doc Angela mentioned about pap smear. So are there different types of that test that could detect and some doesn't detect?
Well, yung pap smear kasi it can either be a conventional pap smear where it will be placed in a slide and then fixed and then read by a pathologist. Now there are different technologies now where we use a liquid-based pap test where we get samples and put it in the liquid and it's processed. So it's they're able to see better the abnormal cells. No? And
Okay.
right now there is a recommendation to shift from the pap smear to HPV DNA testing. Kasi before, like, for example, every 3 years yung pap test, ngayon yung HPV DNA pwedeng every 5 to 10 years. So, nasi-spread
Okay.
mo yung cost of screening. At the same time, you're able to pick up more abnormalities with the DNA testing.
Okay.
So up
Okay,
until
Thank
that
you.
time that we can shift to that practice, we have to make sure that women get to see their gynecologists and get
Yes.
screened.
Yeah.
Yeah.
Kasi it's part of the regular, ano na yun eh, parang maintenance for women.
Yeah. It's
So,
like a maintenance check
kulang,
ng coach.
kulang yung information on what are those types that we can do.
Yeah. Another thing I'd like to emphasize now, even if the WHO says that the age of screening would be at 30 years old, women, especially the young ones, should still be having an annual gyne check. We want to screen for other sexually transmitted infections, gonorrhea, chlamydia, and other infections that can be treated because if untreated, can also lead to infections like pelvic inflammatory disease.
Okay, thank you,
Thank you,
Dr.
Doc.
Angel. That was very interesting discussion. I have a question for Dr. Butch. Doc, if I acquire HPV and then I have my vaccine afterwards, can I still spread the virus to others?
Unfortunately, the vaccines are therapeutic. They don't treat current infection. But what we know, and there's data on this, if you're currently infected and you get vaccinated, the chance of that infection being recurrent meaning manifesting with symptoms, is lowered by about approximately 70%. So the vaccine will decrease your risk of getting recurrent symptomatic disease because the vaccine is able to stimulate a robust immune response in contrast to a natural infection. When you get infected kasi, no, with the virus, I failed to mention that the virus stays in the epithelium, doesn't go to the blood. Because there is no viremia, no, doesn't go to the blood, the immune system, the natural immune system to an infection is very weak. It's inefficient. That's why people, they can get frequent recurrences of the symptoms when they get the infection. Now, if you're vaccinated, di ba, tutusok sa iyo. So it's a systemic administration of the virus-like particles, and therefore the immune system is able to respond efficiently to it. So, kunyari, the bottom line is if you're infected, even with the strains that are in the vaccine, you get vaccinated, the benefit is you get a decreased risk by about 70% of having recurrent symptomatic disease due to the infection. It will not eliminate the latent or the current infection, but it will protect you against repeated symptomatic infection. The risk reduction is about 73%. There's data already on this. That is why now when kunyari, a patient with genital warts, obviously infected siya, no? Genital warts. We treat the genital warts, we give kunyari, imiquimod, etc. And then we vaccinate with the vaccine 6 and 11. So three-pronged approach. We treat the lesion, we give immunostimulants like imiquimod, and then we vaccinate. Yun yung holistic approach niya so that the genital warts will not be recurring as often as they would if no vaccine was administered. I hope that's a little helpful. for that.
Doc Butch, just another question, medyo somewhat related, pero kasi you mentioned it's not curative, di po ba? But does it in any way affect the progression? Does it like slow down or in any way halt the progression of the disease? Hindi nga siya curative, pero na-affect ba in any way? That's a question from the audience.
No, doesn't affect. So, kunyari, may genital warts ka ngayon, still with genital, that's why you have to remove the genital warts. So, kunyari, precancerous lesion, you have to remove the precancerous lesion depending on the stage, etc. What we're talking about here, the benefit of the vaccine is future active infection leading to disease.
Okay, thank you for that. Now for Doc Angel, this question is it's about the vaccine. So what if I actually two questions related to giving the dose, no? Yung isa sabi, can the vaccine be given earlier than the scheduled next dose? And the other one is asking naman particularly about the quadrivalent and the 9-valent. So sabi niya, I understand it's given 026. So it can it be given earlier like 014?
Yeah, there are alternative schedules for those who are in a rush to get it. But in general, we recommend you stick to the dosing regimen on paper that's registered to get a maximum benefit. No? So I think Dr. Butch will have more insight on the shortened version. But yeah, ideally, can give it later and not earlier. Sir?
The fastest you can give it, as Wen mentioned, is 0, 1, and 4.
0, 1, yes.
That's the fastest and have the same quality result, kumbaga, no? Yeah. If you give it too fast, 0, 1, and 2, no, the third dose yung binigay mo at 2 months is an invalid dose. You have to repeat that dose later in a later date. But as Angel mentioned, better late than too early when we're talking about multi-dose vaccines. No? So, wag magmadali. 0, 1, and 4 is the fastest for the for the quadrivalent and the 9-valent. I suppose that might apply also to the bivalent as well. But remember, when we're talking 9 to 15-year-olds, you only need 2 doses. Isang ano yon, no, Michelle, for recommending it to young people. Katipid ka you only give 2 doses. Yes. Is 6 months apart. So, imbis na yung 3. And there is this assurance, no? Kahit na binigay mo at 9 years old, for at least 15 years thereafter, the vaccine is
protected siya.
So, it's not as if 9, napakaaga, and then you have to repeat. Hindi. So far, 15 years. And they're still counting. It's possible lang, hindi pa sure. Baka lifetime, baka lang, hindi pa sure. At least 15 years kasi the vaccines have been given the very first time 15 years ago.
Okay.
Thank you for that. Now, nandito na tayo sa burning practical question. How much is the cost of the vaccine? 4-valent, quadrivalent, or 9-valent, non-valent? Mga magkano pong range ang mga... Maganda to kung nako-convince na natin yung mga participants na to consider the vaccine. So now they're asking about the price already.
Yeah, the price.
Yes, kasi it's a very practical thing. Paano po ba ang presyuhan nitong vaccine administration?
Because the vaccines are generally available to your healthcare providers, no? Although there is a DOH vaccine rollout already. So it's free, no? Yung quadrivalent, they're giving it for free sa mga, kaya lang, limited access pa sa mga medyo economically deprived, mga 13 to 14-year-old girls lang, hindi man boys eh. So very limited pa. So yun, free yun, walang problema. Pero most of the rollout now is through your private healthcare practitioners. So you can imagine, iba-iba yung presyuhan dyan, no? Depende sa patong ng doktor, etc. No? Yung mga ganun. But I don't mind saying this kasi it's naman talaga known. No? For the 9-valent vaccine, no? If you order one dose is 5,700. And then you need 3 doses. No? Kung minsan, merong times like right now, merong promo, yung drug company, sabihin nila 2 plus 1. No? So you order 2, you get 1. So kompleto na yon for ano. And same cost. So kunyari, 5-7, you can do the math. Lalabas siya, cheaper. For the quadrivalent, as far as I know, I generally don't recommend it. Kasi we have a good 9-valent. Quadrivalent, as far as I know, it was about what, 273, no? Before, at cost yun, at cost. If you order from the company or the distributor per dose. And then sometimes kunyari, I order 50 doses, sasabihin ng distributor, oh doc, if you order 50 doses, may konting bawas, no, etc. By the bivalent, as far as I know, is about 1,700, thereabouts, no, yung mga ganon. So, para siyang cellphone. Di ba? Yung cellphone mo, so kunyari, hindi siya smartphone, siyempre medyo mura siya. Kung meron kang 2-year-old model, ganito ulit yung presyo niya. Kung padating pa lang, pre-order pa yung gusto mo, siyempre top price ang and then full tawag doon, features, yung ganyan. So it's really about also value for money, marketing strategies, etc. And siyempre may ano pa yung doktor mong mag-gain check. Siguro kung nasa Makati Med ka versus nasa PGH ka lang. No?
Right.
So, yung tipong gano'n, I'm not really sure about the
practical considerations. Now we have a lot of questions, but we're going slightly over time, so I need to ask this one last question to wrap it up. What if the patient, this is a question also from the audience. What if the patient is presented, kunyari sa area niya, ang available ay bivalent. Nabanggit na ni Doc Butch na meron naman bivalent. So at this time where merong, yung nabanggit nyo, merong bivalent, merong quadrivalent, nonavalent, paano kung ang available bivalent? Can you please give advice, and this is for any of our speakers, give advice to a patient who is probably hesitating on getting the vaccine just because hindi siya quadri or nonavalent. Meron bang I guess the question is, may value pa din ba ang bivalent vaccine sa panahon ngayon? Any of the speakers can answer this. May value pa rin po ba ang bivalent HPV vaccine?
It contains 16 and 18. It protects you against 70% of cancer of the cervix and many other cancers. So, kesa sa wala. No? So, go ahead. Kung yun ang available and you can't afford the more expensive, broader coverage vaccines. Again, para siyang cellphone, at least nakaka-message ka, nakakatawag ka. No? Yung ganon.
Yan, at least,
cervical cancer is not a joke. It's not a joke.
Yes, Dr. Angel, you were saying something?
That's true. Yan yung parang the best vaccine is the one in your arm. That one we can say for any of the HPV vaccines. But yes, just like what Dr. Manalastas says, we have options, and people should, be able to discern which one is best for them, what they can afford, but it should not preclude you from getting any type of vaccine. At least, a takeaway message here is that HPV is preventable through the vaccine and through, of course, lifestyle modification and screening. Michelle has a reason.
Hey, that's true, no? And also, as a last addition, Michelle. Michelle, are you raising your hand, Miss Michelle?
No. Doctor already answered.
Okay, that was kanina. Okay, also so to close the discussion on the bivalent, and it would also help to inform our audience na yung bivalent naman has evidence for sustained immunity, sustained protection over a long period of time. So that's one of the positive things about that. So like our doctor said, importante talaga na magka-HPV vaccine. Okay, so to wrap things up, here are some of my takeaways from today's very, very informative forum. First of all, HPV infection, like Dr. Butch said, it poses a significant global burden due to its wide spectrum of disease. It ranges from benign but highly recurrent genital warts. Sabi niya, caused by types 6 and 11. These are from low-risk types. And it also ranges to genital tract cancers. So this is resulting from persistence of infection from the high-risk HPV types, like I mentioned, type 16 and 18. Genital HPV is the most common sexually transmitted infection in both men and women, and it causes a silent epidemic due to its high transmissibility. Maraming risk factors. They involve any form of sexual contact, penetrative or non-penetrative, risky sexual behavior, and a risk factor is being vulnerable due to not being vaccinated or if you're immunocompromised. Another takeaway is that HPV infection is diagnosed through a combination of physical and pelvic examination, nabanggit ni Doc Angel, together with diagnostics like pap smear or cytology, visual inspection with acetic acid, HPV DNA testing, and biopsy. And lastly, is for treatment options mentioned by Doc Angel. Treatment options for benign warts include a variety of treatments like electrocautery, interferon injections, surgical removal, laser therapy, cryotherapy, and even medications. Treatment for genital cancer, it involves surgical procedures as well as chemo and radiotherapy. But as Doc Butch said in his slide, HPV is highly preventable, and primary prevention through vaccination represents a feasible intervention with best results seen when the vaccine is given even before exposure to HPV. So before we end, Dr. Manalastas and Dr. Bandola, may we ask for your final words, which you want our viewers to remember from this forum. Let's have Dr. Manalastas first.
Again, same messages. Fortunately for HPV, we have vaccines that are known to be safe and effective. Maybe a little costly for some kasi hindi siya pa widely provided by government, no? So unlike other diseases kasi wala tayong vaccines eh. Well, aside from hepatitis B, this is the only infectious disease where we have efficient and safe vaccines. So preventable, totally preventable. Thank you.
Thank you, Doc Butch. HPV is totally preventable. Now, Dr. Angel, any final words and a few reminders?
Yes,
for our
yes.
audience?
So, thank you. So a few words, I would like to say that we can do much better, and there's a lot of work to be done in terms of preventing HPV infection. No? So we should be advocates for vaccination and also try to push screening for HPV to prevent genital warts and cervical cancer. Thank you.
Thank you, Doc Angel. Push for vaccination and screening. So again, our sincere gratitude to our speakers and to our reactor, Ms. Michelle Lim, for giving everyone an informative overview of our topic today. Before we end, we, the MU webinar team of the Mu Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. This event would not be possible without our co-presenters, In Life Heroes and the Mu Sigma Phi Foundation, our co-sponsor, Merck Sharp and Dome, and our official media partner, our awesome planet. We are also grateful for the unwavering support of the UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine. And most of all, we thank you, our participants, for spending your lunch hour with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form. The link is on your screen, I believe. Within 3 days after the forum, you may find the links to the evaluation form at the comment boxes of FB Live, YouTube, and the chat box of Zoom. We would also like to invite you to be with us again on the next leg of MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on November 23rd, Tuesday, from 12 to 1, with a webinar entitled HPV Gone Viral, Why? Or HPV gone viral? Bakit? Which will elaborate on the reasons for the rising HPV infection rates in the country and on the ways of educating the populace on HPV prevention, which would be a good continuation to what we've learned today. For that webinar, we will be having Dr. Kat Remolino and Dr. Sonia Salamat as our speakers, also moderated by yours truly. And likewise, please support us by participating in our year-long Women's Health Forum series. So thank you very much and have a good day.
Thank you, everyone. Thank you, Wen.
Thank you.
Thank
Thank you po.
you. Thank you, Doc.
Thank you, Ms. Michelle. Thank you, Doc Angel.
Thank you.
Memorial Women's Health Forum.
Thank you, Michelle.
The MU
Thank you,
webinar
Doc.
team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck Sharp and Dome. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MuWebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MuWebinars and our Twitter timeline at twitter.com/MuWebinars. You may also email us at muwebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on November 23, 2021, Tuesday from 12 to 1 p.m., entitled HPV Gone Viral, Why? Or HPV Gone Viral, Bakit? Which will elaborate on the reasons of the increasing rates of HPV infections and ways of educating the populace for HPV prevention. The speakers will be Dr. Kat Remolino and Dr. Sonia Salamat, and to be moderated by Dr. Wen Raymundo. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.